Hello, everybody. I'm so excited to see you, and I'm sorry that you can't see me today. I am the victim of the pollinating in Mississippi, as we like to call it. And after a little bit of yard work, it has taken me down, and I'm about to lose my voice. So I'm going to be brief when I introduce my so excited Dr. Michael Bagnell today, our guest presenter. I was talking about him last week. Remember, Joe, we had his beautiful wife, May Bagnell, on here several times. Dr. Bagnell is one of the most fascinating speakers I've had the pleasure of hearing. Luckily, my schedule allows me to travel around the country, attend many events where he is teaching, and nobody can talk about the brain like he can and make it so easy to process and understand, which I truly appreciate. Because like I tell everybody, I'm not a doctor. Tell me in layman's terms. I don't even have to say that because that's exactly what he does. He's been in practice for over 28 years, received his postgraduate training in pediatrics, my absolute favorite, sports injuries, kinesiology, functional medicine, and biomechanics. Can y'all tell? See, he's got all the credentials that say Christy is going to love him. He completed additional training in brain injury rehabilitation and obtained his Fellowship of American Board Brain Injury Rehab in 2015. He competed in collegiate football and masters track and field competitions because he's kind of amazing, kind of like Clark Kent and Superman. And I'm super excited. He has published books. He's got a new book. He actually just received it in the mail today. So if you're going to be in Miami for FCA, stop by the booth because he's going to have one. You can learn more about him at www.bagnellbraincenter.com, because I could go on and use the whole hour talking about all the cool stuff that you and May do.
Yeah.
But then they wouldn't have the benefit of hearing from you. Also, I don't think my voice is going to hang in there longer. So I'm going to turn it over to you, Dr. Bagnell. Thank you so much for being here today.
Thank you. You're always a great introduction. I'm going to share my screen. Which screen am I going to share? That's the question.
This one's perfect. I'll just pull up your, yep. Oh, hit the flip flop where it's, because we're seeing your presenter view.
You're seeing the other view. Okay, let's get out of that one and show the proper view. You're still seeing that, aren't you?
I am. Where is it? So there's usually a button that flips it, so it's the other way around on the PowerPoint.
Mm-hmm.
So you can switch it.
I wonder if it's because I have this screen behind me. Let me do this.
Don't y'all love it before we go live? We go and test stuff, and then we just, stuff just happens. Hey.
How is that?
I can't see your screen again. You're going to have to click to reshare it.
Okay, reshare. Here we go. I see 500 screens here.
That's perfect. Yes.
Now?
Now, and I'm going to mute myself because I don't want to comment because I get so excited when you talk. So,
okay, here we go. So, I'm really happy to be with you all today. I appreciate the opportunity. Really, we're going to just roll right into this because chiropractic is brain-based healthcare, right? I mean, we've known that for a long time, many of us. I heard that about 20 plus years ago at an FCA conference, a Florida Chiropractic Association conference. I heard one of our chiropractic colleagues who'd been involved in functional neurology or chiropractic neurology say, perhaps if we would have kind of taken a turn a little more towards the brain and nervous system rather than the bones and the spinal system in the 20s and 30s, maybe we would have been thought of, perceived a little differently. And when he said that, I kind of like mulled over that for a little bit of time and thought, maybe so, because really in the perception of most of our patients, if you ask them, if you gave them a question, which of these are probably the most important doctor? Podiatrist, chiropractor, obstetrician, neurologist. Probably most people would pick neurologist because in their mind, in their perception, the brain is very important. And if you get to that level of needing care, something's really important. Of course, obstetrician would be important at a certain time as well. But I am Dr. Mike Bagnell. We're down in Miami, Florida, and everything is bright and sunny today, and we're heading back into summer. But we have really shifted the model of our care into a brain-based model. And I'm going to share with you some of those things. But to do that, I'm going to kind of step back a little bit because I want you to understand a little bit about why chiropractic is brain-based healthcare, really is. Number two, I want to share with you just a few of the ideas of bringing your practice forward a bit. And you would say, listen, my practice is great. I don't really need to do any of that. And I would say, well, that's fantastic. We want our practice to be thriving and robust. But, we add things to our practice year by year or decade by decade so that we can keep ourselves unique and fresh and providing up-to-date types of clinical approaches with people. Of course, you know that if you've been in practice for more than 3 or 4 years, which most of you have. I mean, I've been in practice 32 years, actually. And so I've been through an evolution in my work where it's been a little bit of this technique has been more dominant, and then I added a little bit more as I saw there was a greater need in the population I was serving. So that's another thing. You'd want to see what population you're serving. But the reason I want to bring brain-based healthcare to us is because it ups the game. It ups the bar, you might say, or ups the game. It raises the standard. And it also raises, in my opinion, the perception in patients' minds, people's minds, of what chiropractic can do. And it's not just chiropractic by itself, although chiropractic adjustments are one of the single most powerful ways to impact the brain, but it's chiropractic and a few other things that we also provide. So let's get into this. So here's today's topics: understanding our place in neuroscience healthcare. And yes, you could even say that chiropractic comes now under this umbrella of neuroscience. We want to talk about creating a brain-based conversation in your office and improving outcomes with brain-based thinking. And then, of course, some of you have seen our work with the Dolphins, and we have put together several programs that are actually relaunching this year in July. And they're week-long programs where we do work in the office and in the water with dolphins to change the way the brain is working and build brain resilience. And so I'll have more about that as we get on. But if you haven't seen it, it was in the American Chiropractor magazine in March, I believe. You can see the whole layout, and it shows you pictures and gives you an idea. And I have the link for that. If you're interested, we can get that link to you and you can read the PDF. So brain-based healthcare. There's been an increased attention over the past 6, 7, almost 10 years now with concussions. And with the concussions, or TBI, mild traumatic brain injuries, we know that has raised the awareness in the community at large. So many more people are aware of concussions and head impacts. And every time I speak throughout the country so far, and last couple of years, and even throughout other countries in Europe, when I poll the doctors, the clinicians, the physicians in the audience, I would say it's more than 50% will put their hand up and say, I believe I've had some kind of concussion. And when we do that in lay populations, we find that there's a much lower percentage. So what's the difference? I think it's the understanding that you don't have to be knocked unconscious, you don't have to be vomiting, you don't have to have even hit your head to have suffered a concussion or a mild traumatic brain injury, because this shows something impacting the head. But it's the movement of the brain inside. Everyone knows that. But actually, it's also things like the torsion of the spinal cord as the head moves into an oblique position or a torsion position. So anything like that where the head is moving and rapidly accelerating and decelerating can create changes in the brain. And chiropractic can, of course, if the neck is moving like that, you may have a cervicogenic component. So today I want to help you stay curious, right? Consider what else might be contributing to your clients, your patients. What else might be contributing to their problem? Does somebody with a chronic sacroiliac issue, could they have a brain-based component to that? Or someone with a chronic shoulder stiffness or weakness that's been a problem that you've been treating because, through the cervical and biomechanics and therapies. You know, it may not only be the obvious thing. We want to kind of train people. I want to share with you to think differently and stay curious about things. I always land there around December. I say to myself, you know, what could I do better next year in my practice? How could I do things a bit better, a bit more accurate, a bit more, whether it's sometimes it's just about things that are administrative. I want to increase and improve that. Actually, Christy and I were just having a conversation about payment and reimbursement and ChiroHealthUSA prior to starting this, because I need to understand more there. That's not my wheelhouse. So I rely on the experts like those in ChiroHealthUSA and other places to help me understand that. So this is a book that I wrote a number of years ago. It's currently out of print. We have the new book that's out, which is called Concussion Discussions, and you can get one coming up soon at the FCA, or if you get in touch with me, we can probably get you a copy. So here's our thinking differently model for today. We want to go from thinking about muscles and bones in our work to neurons and networks. We want to go from thinking about removing nerve interference to upregulating neurology. We want to go from thinking about adjustments in the bones, not as bones, but adjustments on the bones, to using those adjustments as neurologic levers. And then we can also talk about joint motion and function to think about neural modulation of joint motion and function. So you can see the whole thinking here is just kind of shifting it. You're still doing the same work. You're still adjusting today or tomorrow, whenever it is. But your thought process, even going on with you, is this is really going to affect their brain, their neuraxis, their nervous system in a more powerful way than just that local area of improvement. And so maybe brain-based healthcare in the chiropractic practice starts with you and me. Maybe it starts here between my ears, that I'm starting to accept that, like, wow. And you know, that's probably true, because over the years, the decades, where we've gone from, you know, a cash-based to a blended insurance and cash-based back to a cash-based practice, there were times where I had to change what's going on between my ears and my thinking basically about that. And when we changed our office hours and when we decided to do things differently that we knew was going to affect the population that we had, we hoped in a positive way. But sometimes the fear didn't allow me to think differently until I got some coaching, and I'll talk about that. So here is really the element that underpins this. Is neuroplasticity in the CNS, the central nervous system, the missing link to our understanding of chronic musculoskeletal disorders? And you can see that's referenced, right? So this is already being considered among many in physical medicine. And you can pick this up off of PubMed 2015 from BMC Musculoskeletal Disorders. And you can read that review and say, wow, is neuroplasticity the problem with some of these chronic patients that I see? Here's the actual article. And I'll just give you the takeaway. The recent findings suggest that a change in model and approach is required in the rehab of chronic MSD. So they're already saying that, they're already finding that, and that the effects of the current interventions may not specifically address all the underlying neuroplastic changes in the nervous system potentially associated. So, you know, the things that we're doing may not be totally addressing them. And we would say what we do as chiropractors is use bottom-up types of procedures, right? Adjustments are bottom-up through the spine and the extremities up. Even if you're an upper cervical, it's still bottom-up. And we're using things like kinesiotaping, and we're using things like physical therapy modalities and stretching and strengthening and exercising and core work. And we're using bottom-up mechanisms. And I'm going to share with you a little bit more about top-down, which work more on that nervous system or that central nervous system. So Dr. Heidi Havik out in New Zealand has put together and actually came out with just yesterday, I believe it was, if not this morning. She has a new paper, her and her team, on the subluxation, and we'll want to get that because what she's seeing in their research, and she's one of our top researchers in our profession right now, really researching chiropractic, right? And the effects on the nervous system and what is the real nature of chiropractic and the vertebral subluxation, to use that language. She says that the subluxation represents a state of altered input to the brain. So it's altered input coming into the brain. That's what the subluxation is. And so this may be a makes maladaptive central changes that can occur and lead to dysfunction and pain and symptoms. So The subluxation, and it might even be more intriguing and provocative to think that maybe many of the subluxations that we deal with, misalignments in the spine and extremities, may actually be compensatory to something going on in the brain. And you can think about that for a little bit with a model of someone who suffered a stroke. Stroke on the left side of the brain, postural changes, joint angulation changes onto the right side of the body. Interesting, right? So we can think about that in a neurologic way. But if you break it down for us a little bit more with this chiropractic and brain-based healthcare, there's a vestibular component coming through the information from the ears. The visual component that we use as human beings is dominant. The proprioceptive, which you work on all the time and are expert at, and the auditory. And all these sensory inputs come in, they're integrated, and then they're sent back out so that we can have movement, motor activity in our environment and controlling our posture. I mean, can't even tell you how many really tens of thousands of postural exams we did in the first 20 years of practice. So posture is inherently linked to the brain's function. More and above, it's prioritized to the spinal system. So when the brain has damage or injury, the postural system is going to be altered and influenced, right? Think of someone with Parkinson's, how they have the camptocormia, the forward type of posture. Why did they get that posture? And they have that extreme stiffness in the upper back that many of us have probably tried to adjust. Why? Or their neck is very stiff. Why does that happen? It's all a neurologic driven mechanism. So to look at it a little differently, this is where you and I hopefully are experts at. Proprioceptive input, spinal, joint mechanoreceptors, muscles, we're working on those all the time. But I'm going to talk to you a little bit about vision and why that's important to understand at least and bring it back into your thought processes. And I'm going to talk just a little bit about the vestibular system. And so it really requires this model for us to study a little bit more. So this little diagram here will show that the vision, the vestibular, and proprioceptive inputs converge on the brainstem. Remember that area? Well, we had to memorize those cranial nerves, whichever way you memorized it. But that's a really important area, that brainstem, and all these receptors will have their inputs going through that brainstem. And so we work on the system with people, the biomechanics here, skeletal integrity and joint stability and flexibility. But we also have to think about the sensory inputs, not just the mechanics. And then we want to know, why would someone have problems in their spine or extremities? Well, here is really a more scientific explanation, if you will, or the proper language, that a mismatch of sensory inputs creates an overload. So if my eyes are telling me, well, let's talk about a real situation. A patient comes to you and they have some nystagmus and they feel dizzy. The world is not moving like that, but their eyes, you can even see from the outside, are moving. They say, oh, doc, I'm really dizzy when I turn my head to one side, and their eyes are having nystagmus, which you already know about. And that's going to cause them to have a reaction in their body, their motor system. So their eyes are telling their brain, I'm moving. But their body is saying, I'm not moving. And their vestibular system on one side may be saying, I'm moving. And the other side is saying, I'm not moving. So you have all these sensory inputs that are conflicting, and the brain ends up having to compensate. The brain compensates. Here's what you have in red. Compensation may include muscular, visual, cognitive, emotional, or vestibular. You can have compensation in all of those domains. And so this is why this thing really becomes exciting. So a little review of our vestibular system. The ears have two functions, right? Hearing and vestibular, and it's not just balance. So just a reminder, 3 semicircular canals on each side, 2 otoliths on each side. The otoliths are your gravity detectors, and your semicircular canals are for angular head movement in relation to the body, so that the brain knows what's going on. Am I in a car that's traveling and I feel the acceleration, or in a plane? Or am I going up and down? That's all otolithic. Or am I moving my head like I'm on a field and I'm watching a ball going around? So these vestibular components all interact, and 25% of that information goes up to control the eyes and make them stable. and 75% of the information goes down to your spinal extensors, right? And so this is really where you're working every day for the most part. It's the fastest firing system, the vestibulospinal tract. And it's really involved with all these things. You can see it on the right in the diagram there. The cerebellum is involved. It gets information from there, the oculomotor nuclei, the spinal cord for your postural tone. I mean, what's more important? What's more integral to us than that, right? The thalamus and the cortex, it affects your motion, your perception of motion, your spatial orientation. And even there are people in the neuroscience world that believe right now that your vestibular system, which is always in an on position, right? Just like your heart, it's always beating, your brain, it's on. The vestibular system has tone, always. And when you turn your head, it activates more on that side, and then the other side is less. And then when you bring your head back, it activates the other side. So there are people in neuroscience that actually are seeing that the change in tone, an asymmetry, if you will, on one side, always firing higher on one side, is affecting a person's sense of self. So this really affects and ties to the psychological person that you're dealing with. All right, so let me take a little break from all that science for just a minute and talk a little bit about dolphins. You know, we developed this camp with dolphins, and there's some really unique things, differences and similarities between the dolphin brain and the human brain. So dolphins are primarily driven, their primary or dominant sense is echolocation. Ours is not. Ours is primarily vision. So it's important for our eyes to have a very good input, not just acuity. I have a Snellen eye chart right behind me here, which I don't use that often because I'm more interested not only in acuity, but I'm interested in how the eyes move up and down, side to side, how they track. And so we are dominated by visual sensory inputs. They are dominated by echolocation. But they're dramatically sensitive animals to human physiology and even to human emotions. And they are really quite emotional creatures themselves. So we developed a plan and a program with them where we do work within the water with them to affect a person's brain. So these are the next few pictures are pictures from a brain camp that we did, but it ties into this brain-based healthcare. And so I'm using something here called vision sticks. And this is vision brain training. So when you train the eyes, you're training the brain. This is a top-down mechanism. So this young man is looking at one of the vision sticks, and then he's looking back at the one. So, you know, divergence, convergence, near-far vision for us, right? And this is working areas of his brain stem. And we're doing this because actually he showed up in the exam that he had a problem with this. His eyes converging and diverging and converging and diverging and doing that without fatiguing. And so this is the upper brain stem activity here. So we use those as a very simple model. And, you know, that could easily be done table side for just 2 or 3 minutes prior to an adjustment if necessary. And then here's me in the water working with the dolphins and learning communication hand signals with them. And then back working with more of our clients on the vision sticks there. And I'm making sure that we're watching how he's reading them accurately, because now we even know that human beings are so smart, they'll even cheat on some of these tasks. And we do have a mentorship program for doctors where you can really learn how to bring the brain-based approach into your office. And so that's something that you can email us through once you see this replay or you're watching today. And you say, I'm interested in some of the details. We can help you. We've been working on this model for more than 10 years. And so we have many of the pieces and the understanding of how to coach the doctors that we work with and their staff, their team, to have the proper conversations and have the proper value for what they're doing. So our doctor's mentorship, many of you probably know Dr. Spencer Barron. I took him down for an experience in the water with the dolphins and some of the brain-based activities we did. This is the dolphin meditation that we do. This is one of the young men that works with me here. He's my neurotech. And through the meditation, you can hear the dolphins echolocating in the water, which is actually a pulsed electromagnetic frequency that they're pulsing. And they're doing that just at their own behest. We don't tell them to do it. And then he's also feeling the heartbeat. It's a very unique experience. And when we bring clients down there, people who come to our brain camp are people who've had concussions. We had a doctor come who had no problem, who wanted to just improve his brain resilience and have the experience and get involved with the dolphins himself. We have people with Lyme disorder, immune disorders, variety of conditions. So it's a very broad-based camp, but it's to build brain resilience. We do lots of good measurements with people. This is a wonderful one where the client here is working with myself and the marine mammal specialist. So lots of fun, very exciting, and it is life-changing when you get these experiences. Is chiropractic adjustment part of this camp? Yes, but how long does a chiropractic adjustment take? Just, 30, 40 seconds, a minute, 2 minutes. That's a very small part because it's a very powerful, as I said, bottom-up influence on the brain for our clients. So in this week intensive, they may get adjusted 2 to 4 times, I would say, in the midst of the other therapies. Just more wonderful. Look at how beautiful that dolphin is. We have one activity with the dolphins we developed where you are with a mask, a diving mask, and you're eye to eye with a dolphin, 650 pounds right next to you. It's one of the more remarkable things you get to experience in this world. And there's my son, Zach. He works in our practice in the neurofeedback department where we do brain mapping, but here he was recording the actual echolocation underwater during the camp. Wonderful, right? So let's get back to this now. We see a little dolphin interlude, we can call it there. Why the eyes? Why are the eyes important? Our world is one of visual and acoustic overstimulation. Wouldn't you agree? I mean, right now, you're using your eyes and we're on the computer and we're all zoomed out, aren't we? But this is important because this happens to so many of our people today, not only our kids, but all of us. Vestibular and proprioceptive understimulation and visual overstimulation. So this can really throw the system out of balance in the brain system, if you will. The visual system is our dominant system. And this is probably one of the more important slides in the whole presentation, that your spine, our spine, is one of the greatest areas of compensation for the brain, for brain changes. Again, go back to the stroke as the most extreme example. Person has a stroke, their posture changes, their spine changes, but we also know that there's research based in the vestibular system and scoliosis. So the visual system uses most of our brain networks. So coupling eye strategies with movement strategies will give you better outcomes with your clients in conjunction with adjusting. And those are things you have to learn. They're not excessively complicated, but they're using them in sports teams now all around the country. They're using them to improve movement and perception, reduce the incidence of concussion, reduce lower extremity injuries by training the visual system for movement. So we do some very high-tech things. We track visual movement. It's related to the motor output of your brain, right? The frontal part of the brain is the motor output. And we look at the eyes, we look at gait, functional movements like many of you, and then also thoughts and cognition are movements. So we use a very specialized device, one of them called a saccadimeter. You're seeing it here with one of my team. We're measuring and tracking those eye motions. So, we got to think about the reason that these things are happening is our brain, or the reason that we measure the eye movements, because first of all, they're the fastest movements in the body, eye movements. Number 2, they tell you about the brain networks because they use the whole brain. Number 3, they're easy to measure, and they're making maps. If we're visually dominant creatures, we're making maps in our brain. So wherever you are now, or whenever you're watching this, if you were to close your eyes, you probably could tell me where most of the things are in the room that you're in. Like I know I have 3 doors in this room, or 4 doors, a closet, a bathroom, an entrance, and an exit door. I know I have a table here, and I'm looking at you. So your central vision gives you not your maps, but it's all the peripheral vision that makes the maps of your perception of your world. And this is very important to understanding that sensory error. Because if another example, if you were moving your body didn't have a proper understanding of the depth of something or where the edge of the door was, this is showing you that your maps may be a bit off, maybe a bit skewed. Now, one time, not so much, but if you have a repetitive, I always bump into that door frame on the right when I go into that room. Maybe there's something, right? I'm telling you to think differently. Maybe the way your brain is working, your map is a bit skewed and your brain thinks it's here and it's actually there and you bump into it. Same thing with a car. Some people tend to scratch a side of their car who have issues, or bang their car on one side more. Why does that happen? It may be related. We're not certain, but it may be related to a skew of the maps in their brain. And how do these maps get made? Mostly from the vision. That's how most of the information comes in, from the outside environment. But what about the inside environment? You're right. Your brain has a somatosensory map up here. The homunculus and the homunculus, it shows you all the, it's that weird, odd looking shape. It looks kind of like a monkey with the big hands and the big facial features, because those are sensory areas that have more input to the brain. So brain maps are really crucial, just like on your phone. When you want to find a destination, you better hope those maps are accurate, or it's going to send you a block away, or to another street that's similar, because it sounds like that. We need accurate maps. And here's your maps. Somatotopic, that's your somatosensory cortex. All you doctors know that. Every time you do work on a patient, it goes right into that area, the back of the brain, the parietal cortex. The motor map, it's just in front of that. It's for motor movements that are accurate. You want to be able to do a finger to nose test with a client accurately. You don't want to see them missing your finger or having some kind of ataxic movement to the finger. There's the retinotopic map, which is your retinas for vision. And there's the tonotopic or phonotopic maps for sound, right? You check that all the time. That goes into the temporal lobe. So you see how we can start to understand different areas of the brain a little bit, and the different maps, and are they integrated well? But I can tell you, when we work with pro athletes, that's one of the things we do. We try to understand, how is their mapping systems? Are they accurate? And how accurate are they? Can we make them better? So map building and integration. On the right, you see the homunculus and all those sensory motor areas in the back of the brain, the parietal cortex. This is why chiropractic is brain-based healthcare. It's really activating that area so much. Your afferent inputs, your somatosensory map, your visual map, and then proprioception, which you do all the time. So I'm not going to spend too much time on that because you're expert at that. It's the awareness and perception of your body in space. And what's a sign of a proprioceptive problem? You already know this. Balance issues, trouble standing on one foot. Do you check those things with the client? If you want to have a brain-based practice, I was thinking about this morning, and I didn't Google it, but I was going to. The old chart. I mean, I went to Life University when Dr. Sid Williams was there, and he did a lot for our profession, right? He was a big personality like BJ, But at any rate, what was still on the walls there was the giant two bones with the nerve being compressed, right? The old subluxation model. And, these things came out of Parker University in the 70s, these pictures. Do you still have those on your wall? I mean, I'm not against it, but look, do you still have the same artwork on your wall from the 70s? Unless it's something like a Van Gogh that you bought, a Rembrandt, of course you keep that, but, you update things. And so people are more sophisticated, right? You know this, your clients, they Google everything. I wanted to see when that chart was actually made, even the autonomic system. I think I still have it actually in the closet there. But we want to upgrade things. We want to update things because people are very looking for a more contemporary place. Even when I go to get coffee, I don't want to walk into a rusted, broken down, flimsy thing where I want to go in for a nice experience. So your office can be a pro shop. I took that from CJ Mertz. Your office can be a pro shop. So my recommendation, of course, you have to find what's best for your wheelhouse, is if you want to have a brain-based office and you want to have a brain-based conversation, you may need to upgrade. You may need to make it more of a pro shop. We don't have a lot of different magazines in our office, and there's nothing wrong with that. It's just a different way. We have more things that are more targeted to health. I have a very limited window to work with people, and I want them, when they walk in here, to be immersed in things primarily about high touch, very focused service with them one-to-one. And this is about the brain. This is about the nervous system and their health. And so we really, we bring all those elements together. So that is the experience. And if you're at all coming to South Florida, you're welcome to visit us in our office and get a feel for that. But in your own office, look for uncoordinated movements. Look for balance issues, and can they walk on a straight line, and do their arms swing when they walk normally, or do they kind of like lose their balance when they're walking heel to toe tandem? We should look at those things because they're actually a part of a neurologic exam, which many of us may not do because we check the spine and we leave those things, but it can give you a window into what's going on with them. And this really relates to the cerebellum, the part of the brain that controls that incoming proprioception. And there it is. And would you guess that the cerebellum also has maps, right? The midline of the cerebellum and it goes out to the motor execution. The outside of the cerebellum has more to do with motor planning and thought, and the vestibulocerebellum for balance and motion. So we have all those. There's your maps. Right in the middle, the medial aspect is more for your emotional control. So the midline of the cerebellum and the midline of the frontal lobe have interactions. So that's your limbic area. Isn't this remarkable? How many times you adjusted somebody or a series of adjustments and they say, you know, I really feel much better. My mood, this may be the reason. You increase proprioception, you increase activation of the cerebellar midline, you increase activation in the limbic area through the frontal projections. Chiropractic is brain-based healthcare. Then there's the motor component and the cognitive component, which is going to affect those clients we have with dementia or early cognitive decline. So back to our picture and our model, right? We talked about the vision a little bit, proprioception you already know, and then the vestibular system, which is your acceleration detector. All right, so here's that study, or from that study, where they actually took frog models. They took a frog model, and I always say this at the outset, not all animal models translate to human models, right? I know that. You're aware of that, I'm aware of that. But this is fascinating for chiropractors. When they severed the vestibular nerve on one side in the frog model, developing frog, unilateral vestibulo-hypofunction, the frogs developed a spinal curvature in a very high percentage of the time. That's interesting. The vestibular system controls the vestibulospinal tract, controls a lot of your extensors or the strong influence on your extensor muscles paraspinally. And when you remove that influence, you get a scoliotic deviation. I wish I would have known that many, many years ago, because I would have looked at some of the vestibular function in some of my clients. The number one client would have been my daughter, who's 33. She's healthy. She has 2 kids. She's a speech pathologist. She's a brilliant gal. Her and her husband, a wonderful family. But she has a scoliosis. And I just wonder how much of that is vestibular related. The eyes, the spine, and the vestibular system pair together like your Bluetooth. If you've never heard that and you want to understand more, then you want to come down here for a training and we can help you understand that. Because now I realize not everyone's going to be able to spend the time and the money in a busy practice and get into all the diplomate series as I did and the fellowship series that I did. But if you do want that kind of training, I would recommend looking to the Carrick Institute. That's the one I went through. I really have gotten such an excellent education through Dr. Carrick and the Institute and the modules there. But if you're really not able to do that, then we may be the place to help you kind of put it together. So 81% of healthy people have vestibular deficits and asymmetry. Now this, some people might question that, but this actually from a research paper Dr. Antonucci shared with me. So we know that it's accurate. People have asymmetries. When they go to the EENT, if they do that kind of test for them, they say, yes, you have an asymmetry, but it's normal. Because it's accepted as normal because it's so common. But we know that can contribute to a lot of problems, spinally as well. This is the visual system of one of my 16-year-old female former volleyball players with concussions. She also has anxiety disorder and panic attacks. And so we're looking at her eyes here, and you can see how her eyes are, I asked her to look up and down, and you'll see how that one eye really shoots in. You see that way that eye converges on the left so severely? So this is a neurologic mechanism of her brain stem. So this young lady may have come to you, and she had probable concussions, never diagnosed, but the way she was hit with the ball in volleyball, we know she had a concussion. And she's dealing with anxiety and panic attacks, and we're adjusting her neck. But I was able to dig deeper into this with my training and understand what was going on. Here's a 54-year-old male who played some semi-pro football, and I want you to watch the eyes moving. He came to me with severe spinal pain. He already had a cervical fusion, lumbar disc decompression, and Parkinson's plus syndrome. Look at his eyes now as they're moving quickly back and forth. You'll see. See how they're going back and forth? That's a failing midbrain. And I had the distinct displeasure of confirming for him that he was in the very early stages for himself of Parkinson's. But all the things, the stiffness in his spine, everyone was going after that without really looking to the brain. And so he went through a lot of very difficult recovery with those surgeries. So again, the somatosensory cortex, the somatosensory maps, chiropractic is brain-based healthcare. The cerebellar maps for that, where the hands are, where the lips and feet. You know, we need those maps to be accurate so we can move and do things in an accurate way. And as you know, the cerebellum on the left is influencing by the right hemisphere as it crosses over, right? There's that lateralization. And we work with what we call neuroperformance with our athletes and even our people who are former athletes like myself, as Christy had said. You know, it's really based on accurate inputs, timely integration, and specific outputs. I'm not sure if you knew this, but you know, brain training is vision training, and 70% of the information processed by our brain comes from this visual system. So again, looking and analyzing that, and this is an analysis with that little instrument, and this is what it should look like. I know it gets a little technical, but I want to give you an idea here. So when you look at the red and the green, that's the right hemisphere red and the green is the left, and the overlapping tracings are what we should see when the eyes just go back and forth. So if we look at those, they look very like someone took a marker or a pen and just went up and down on those marks. That's what a healthy tracking of the eyes should look like. Here's somebody, a 41-year-old female multi-sport athlete with anxiety and multiple injuries. Looks very different, right? That one to that one, very different. Here's that normal again. Here's a 50-year-old female chiropractor who had a concussion, but the concussion was many years before I did this. So we know that people end up with injuries to the brain. We're high functioning, many of them, they're still able to go on, and she's a very successful female chiropractor. But yet she did share with me some things that she feels are starting to go on now at her age. And we believe they're possibly related to that concussion. You can see that that's a very dysregulated map. Well, we're coming to the end. I want to kind of give you some highlights here that chiropractic improves some very important things that are brain related. It improves proprioception, which is accurate joint position, right, in the spine, in the extremities. It improves sensory motor processing. It improves sensory motor integration. This is movement. It improves somatosensory gating and centrally modulated pain. That means that it helps to reduce the pain signals coming in and feed forward activation. You know, most of this comes from Dr. Havik, and it's been shown in the research already. But really, I like to tell people, you have to demonstrate this and measure it, because I don't explain any of that language to patients, but I demonstrate things to them in a way that they can understand a little bit more that chiropractic is brain-based. So I hope that you're thinking a little bit more differently today, that chiropractic improves neural integration, that it is brain-based healthcare, and chiropractic adjustments are neuromodulatory. They really are. If you're interested more about the camps, we have those coming up in the Florida Keys. We actually have dates that are booking up now for July and August of 2021, this year. We're so excited about that. And there's many wonderful things that can happen there with our clients and even our doctors. If you want to improve your own brain performance, these are some of the things we do. We'll do a brain map on a client prior to them being in the camp. And I can tell you that this orange-red color, or the red, is 3 standard deviations too much activity in alpha waves for this client. That's not good. We don't want to be in that area. This was someone with suicidal depression. You can see the blue right in the middle, the limbic area, right in that midline on the top. So that was a young person, 16-year-old with suicidal depression. But we work with those types of conditions. We work with people with all kinds of brain-based issues, because really chiropractic is brain-based healthcare. You can follow us on many of the social media if you're into that kind of thing, Instagram, Facebook. Even we have a Facebook page for the Dolphin Camp, and you'll love to find out some videos there. We'll share those things with you. Actually, I may have a video here for you. If we do, let me see if this will play. Yeah, let's see if you can enjoy this.
Down in the books, how was it? Tell me. Besides amazing, was the freezing?
Well, I hope you enjoyed that, and I hope you enjoyed today talking about chiropractic being brain-based healthcare, because it's what you do every single day. Whether or not you've been talking about it doesn't matter right now. Know that you are really dramatically improving people's brain function or activating it. And for more information about our doctor training program, mentorship programs, you can reach us there. And chiropractors, we're a unique bunch, aren't we? I mean, many people are unique, but chiropractors develop some really remarkable things in healthcare. I mentioned kinesiotape before. That was developed by one of our colleagues. So, there's some really remarkable things. We're here to help you develop your practice so you can serve the people you have and develop a practice that is enjoyable for you as well for your clients. So that's what I have for you today.
Thank you so much. I'm so glad you talked about the dolphin experience, because I am seriously, I know I tell you and May I'm going to do this all the time. I really am going to make the time to come one of these days. I really want to do this.
We'd love to have you. And it's not just for people who've had an injury, right? That's what we're talking about. People want to, especially coming out of the last year and a half, how do you improve the function of your brain in a way that is really a remarkable, novel thing? I mean, you should do things like, games on your phone for your brain, but those things we get kind of bored with. When you do these kinds of camps where it's a highly focused week, Christy, it has a stronger probability of making a big impact on your brain.
I'm all about a big impact on my brain.
Yes.
I can hang with y'all a little bit better.
Yes, all of us together.
So I've been getting not just emails, but great feedback in the comment section where everybody was talking about what an incredible presentation this is. I also had somebody who wanted to know, where can they buy your book?
I believe they can get this off Amazon now. Yes, on Amazon, and it's called Concussion Discussion. Concussion Discussion. This is a very good book. Like I said, I'm in there with my chapter on the Dolphins, but there are many other excellent physicians and our colleagues on here that you will love reading these short chapters. It's easy to digest, and it will help you being able to help the clients that might have concussions. So definitely on Amazon, Concussion Discussions.
I'm looking it up on Amazon right now so I can post it. A concussion discussion book. There's a lot of stuff on concussion discussions if you don't type that in correctly.
It's called A Functional Approach to Recovery After Brain Injury. Functional Approach to Recovery. You might also be able to get it at facesoftbi.com. Facesoftbi.com.
We definitely can find it on Amazon because I just posted the link. And if you order it today, you can have it by Friday.
There you go.
So, Dr. Bagnell, I cannot thank you enough for taking time out of your busy schedule to be part of our webinar series today. Not to mention, I absolutely just enjoyed having our one-on-one conversation 15 minutes before.
I did too. Thank you so much.
I have also posted a link to Dr. Bagnell's website, www.bagnellbraincenter.com. If you want to learn more about the amazing work that he and his family, it is a family business, are doing in Miami, Florida. And if you go into our archived webinars and you search Bagnell, you will also find webinars previously done by his amazing, beautiful, and talented wife, May Bagnell, as well. And I strongly encourage you to watch them because she is a showstopper.
I agree.
So they're just like the dynamic power couple. I'm just telling y'all, taking over Miami, Florida right now. And we are going to be joined by Dr. Cindy Howard next Tuesday, who is a mutual friend of myself and Dr. Bagnell. We were just talking about Cindy before we got started on adherence, brilliance, and compliance. And that is sure to be an entertaining and educational presentation because that's Cindy.
That's her. She's the best.
So make sure you go ahead and register for that webinar presentation. And as you know, if you register and you're not able to attend live, we will send you a link to that webinar recording afterward. We will be moving to 2 webinars a month instead of 1 a week in June, because we're going to start spacing them out as we integrate our new up and coming podcast and launching that in June. If we meet our deadline and my voice holds out long enough to actually do a couple of podcasts this week, to be determined. So anyway, thank you so much, Dr. Bagnell. Hugs to May, and I will see you in a few weeks.
Okay, I'm looking forward to it. Get well.
Thank you. Bye.
All right, dear. Bye.